This program is sponsored by
Lanka Hospitals. Caring, curing.
Hello everyone, welcome to Art Medilline program. Art Television together with Lanka Hospitals bring you this program to make you aware of your health and well-being. When talking about Lanka Hospitals, definitely they are the market leader in the healthcare industry of Sri Lanka, providing the best of medical services to Sri Lankans as well as international representatives residing here. So today we are going to talk about benign prostatic enlargement. This is one of the most common conditions faced by males, and to discuss about this we have consultant urologist Dr. Kalana Parana Palliyaguruge. Hello doctor, nice to have you with us today at the Art Mediline program.
Hello.
So doctor, to start today's conversation with, let's have a brief introduction about what prostate gland is and its functions.
Yeah, the prostate gland is only found in males. It's a male reproductive gland. It's located at the base of the bladder where the urethra or the tube that takes urine from the bladder outwards is, and the prostate gland encircles the initial part of the urethra. And the prostate gland produces a thin milky fluid that nourishes the sperms. And in men, this gland enlarges with age.
Right. So as we ended on the note of problems, doctor, what are the issues faced by men along with this prostate gland?
Usually there are three common problems related to the prostate gland. Firstly, the topic today also the benign prostatic enlargement, and also prostate infection, we call is prostate inflammation, also known as prostatitis, and then thirdly the malignancies related to the prostate gland, that's prostate cancer.
So doctor, out of these three issues, we mentioned that benign prostate enlargement is the most common condition faced by men. Would you like to give a brief introduction about benign prostate enlargement and why it is so common?
Yeah, for example, 60% of men at the age of 60 having this problem. So that's that common. And if we get the name benign prostatic enlargement, it's also called benign prostatic hyperplasia or the BPH. As the name derives, benign is non-cancerous, prostatic is related to the prostate gland, and hyperplasia is enlargement of the gland due to increase in cell number. So that's how the name derives. So the testosterone is the main male hormone that causes the gland to increase in size. Above the age of 30, usually this gland slowly increases in size and causes problems. But at the age of 60, although 60% of men have this enlargement, only 40% will have symptoms.
So this disease is basically the enlargement of the prostate gland, right doctor?
Yeah.
Okay, how does this differ from the other issues you mentioned, doctor?
Yeah, the other issues I said, the prostatitis or
Yeah.
the inflammation of the prostate gland. It's a condition that happens temporarily, that's from bacteria or some other organism that causes inflammation of the gland. And thirdly, the prostate cancer, that's a condition that happens in cancerous growth of the gland.
Right, so that's how the benign prostate enlargement differs from the other issues, right? So when we come to the benign prostate enlargement, doctor, what are the symptoms you find in a patient or a person who's going through this condition?
Yeah, so the symptomatology or the symptoms can be classified into three parts. First is the storage symptoms, secondly the voiding symptoms, and then the post-micturition symptoms. If we come to the storage symptoms, because the bladder contains urine and it's expelled through the urethra, and the symptoms related to the symptoms are frequency, that is you tend to go more often than usual to the washroom,
Right.
And then urgency, that when you get the desire to pass urine, you have to go, you can't wait, you can't bear up. And then thirdly, the urge incontinence, that is sometimes you get accidents in between, you make it to the washroom.
Right.
Right. Then we come to the voiding symptoms. Firstly, the stream, the urine stream is weaker than before, and you tend to take longer time. And then thirdly, the stream becomes inconsistent, or we call it
It doesn't
flow well. So we call it intermittent stream.
Right.
And then the latter part of the stream is very slow. We call it terminal dribbling.
All right.
Right. And the problem here is people does not go to
Notice all of this?
yes. And then thirdly, then after void you feel the you did not empty fully, that retained amount of urine, that feeling will be there.
That you want to go again and
Yes.
urinate.
Yeah.
I think these are simple symptoms which I think, like you said, people won't really notice, right, doctor? So I think this here onwards, now you know what the symptoms are. It's up to you to be careful and have a note on it and notice your symptoms while you urinate as well, no, doctor? Because these are things which you really can't avoid. So along with that, doctor, now we spoke about the symptoms. How do you really diagnose this?
Yeah, when a patient or a person come to us and say, doctor, I'm having this and these symptoms, then what we do is we classify the symptoms, and we do a severity assessment, right?
Right.
So that's by a means of symptom score analysis.
Right. Doctor, I would like to disturb you right there. Now, since we spoke about symptoms, when we go into diagnosing process, you say when a patient comes and tells you. But also in the symptoms, doesn't the patient get like a stomach ache or any kind of aches in the body or something like that?
Yeah, in this condition, usually we don't get aches or pains.
So definitely the person has to identify it through the symptoms of urinating, yeah?
Yeah, sometimes
Okay.
not the patient, sometimes a close relative or a friend
Yeah.
will notice that he's taking a little more time to urinate than before. Like, oh, he finds it a bit embarrassing to go to public toilets. Like
All right.
those
So
are the
there's simple
examples.
things, but
yeah.
you don't have to really
And
notice.
the other thing is people of this having this condition avoids going to public places or going shopping, because they have to, when he wants to go, he has to go. So he have to have places where you have easy access to the washrooms, right?
Right. Along with that, doctor, let's move on to the diagnosis part. Now you were continuing.
Yeah, actually when a patient comes, as I said, we first do a clinical assessment. So the clinical assessment involves the symptom analysis. So we give we provide a questionnaire that's called so by that we analyze the symptoms and give a severity score as mild, moderate and severe. So that's how we tailor the management according to the patient's symptoms.
Okay.
Right.
So if you just describe these minor, major, the scaling, doctor.
Yeah. So the minor issues, minor symptoms that can be managed by simple lifestyle modifications.
Right.
Right. And then moderate symptoms we'll provide medication, and then thirdly the severe symptoms, then we might have to consider surgical options.
So there we come into the investigation process, doctor.
Yes.
How does that happen once you diagnose the condition? How does the investigation process happen?
Right. Actually, the clinical examination also includes here. So we usually do a digital rectal examination soon after we conclude the a clinical questionnaire with the patient. So that digital rectal examination gives us information regarding the size of the prostate and the surface of the prostate. Sometimes we can diagnose suspicious areas that can mimic cancer
All right.
by just pure digital rectal examination. And when it comes to the investigations, there are several lines of investigations. Firstly, we can do blood investigations to assess the kidney functions, because sometimes this prostate obstruction can cause kidney damage. So serum creatinine can be done, and then the prostate activity can be measured by the means of PSA, and then by the ultrasound scan done by transabdominal or transrectal route. And then thirdly, then we go to other investigations like urine flow rate assessment as well as flexible cystoscopy.
All right. I think that was a very informative segment, but I think we also have to go a bit into detail about all these investigation processes as to what these really are and how the doctors really conduct these investigation processes. But before that, we will be back soon after a short break.
This program is sponsored by
Lanka Hospitals. Caring, curing.
Welcome back after the break. So today, Art Mediline is in discussion with consultant urologist Dr. Kalana Parana Palliyaguruge, and the title we are in discussion today is on benign prostate enlargement. And just before the break, we had the discussion on the investigation process of benign prostate enlargement. Doctor, let's go into brief detail about all of these investigations.
Yeah, first we discussed about the blood investigations.
Yes.
Those are renal function tests and the PSA. And then secondly, we do ultrasound scans, both transabdominally as well as transrectally. That is to assess the prostate size and then the bladder volumes before micturition and after voiding, to see how much we retain in the bladder or whether the patient can empty the bladder fully. And thirdly, we'll check whether the bladder wall thickness, right, as well as the kidneys and the ureters, whether they have swollen up from this obstruction.
So that investigation is done through urine tests?
No, that's by ultrasound scan.
Ultrasound scan.
Ultrasound
Right.
scan.
So a person who comes with this condition has to go through all of these investigation processes, or you choose?
We actually all these the renal functions, PSA, and the ultrasound scan is a must, because
Right.
then only we get the full picture. In addition, we do a urine flow test. That's to check the urine flow, whether it's adequate or not, and then we decide whether the patient require further tests like a flexible cystoscopy. That's a test that we do under local anesthesia, and we pass a very tiny camera after anesthetizing the urethra, and that will provide us more information about the urethra itself and the prostate gland, the degree of obstruction, and the reaction of the obstruction inside the bladder. That is, whether the bladder wall has been thickened and so on and so forth.
Right, doctor. Now you mentioned about PSA, doctor. What is PSA?
Yeah, PSA is prostate specific antigen. That's a protein produced by the prostate gland, and it can be measured in blood. And in some certain conditions, like in prostate cancer, the PSA can be very high. As well as PSA can be used to monitor the efficacy of treatment for prostate cancers. So, as a routine test, we do in men after the age of 50 and not before that. We measure prostate specific antigen in blood.
Right, doctor. Now I think we are covering everything one after the other. We spoke about the symptoms and how the doctors really diagnose it and the investigation process. Now, doctor, let's come into the treatment options for this condition.
Yeah, actually we have mentioned, we analyze the symptomatology, and the first treatment option would be lifestyle modifications, right? The patients will have, the patients who have mild symptoms can be benefited with lifestyle modifications. These people will have nocturia, that is, you have to get up to go to toilet in the, and you have to break sleep. Sometimes these people will get sleep deprivation. So for that, so if
Like
you,
during sleep, you want to go to the washroom.
yes, during sleep you have to get up and go, right? So for that, if we try to restrict fluids in the evening, that surely helps, right? And like the simple steps. Then secondly, when it comes to moderate symptoms, we can give medicine. So usually we have two types of medicine. First one is we call it alpha blockers, or so that drug acts on the smooth muscles of the prostate gland, and that relaxes the smooth muscles and allow easy passage of urine out of the bladder. And secondly, we have 5 alpha reductase inhibitors. That's a drug that acts on 5 alpha reductase enzyme. So that actually this hormone, male hormone testosterone, becomes more potent to dihydrotestosterone. That's the more potent form, and this drug inhibits the testosterone converting to the active form. So from that the drug shrinks the prostate glandular part.
Now, along with this, doctor, I'm sure the public who are watching us today has the question, is there anything to be scared of, doctor, in any of these treatments?
Actually, up to now, what we have discussed is the lifestyle modifications and the medication.
Right.
Actually, if you don't treat this condition, this will not kill the patient, but it has some adverse effects, like patients will have a lot of quality of life issues, like you can't go to a public place, you can't have a good night's sleep, then so on and so forth, then goes to kidney damage if it's not treated well.
So now, doctor, we spoke about the lifestyle treatment, modification treatment, and the medicine. Other than these two, is there any other treatment as well?
Yes, there are a lot of surgical options.
Right.
So
So,
that-
if we talk about that in detail.
Yeah. So when it comes to the surgical options, there are many options available. So we have to select what's best for the individual patients, or tailor-made options. The most common one we have is TURP, or TURP we call it. It can be done either monopolar or bipolar type of resection. So in this surgical procedure, which is there for more than 50 years now, we resect the gland under anesthesia. So we completely scrape the gland by the means of a surgical instrument.
General anesthesia or doctor?
Usually we do it under spinal anesthesia.
Spinal anesthesia.
And then it comes to other options like laser prostatectomy. It can be either laser vaporization or laser prostatectomy by green light or holmium laser. And then there are other options which are still under experimental, like urolift or prostate enhancement by other surgical methods, and transurethral needle ablation and hydrotherapy and microwave therapy are some of them.
So, doctor, if a person undergoes this surgical method or the treatment, how long will it take for that person to recover?
Yeah, that depends on the type of surgery that we perform on the patient. The most common thing that we do is TURP, or transurethral resection of prostate. And after the surgery, usually we keep the patient for 24 hours to 48 hours in the hospital. During such time, we have an indwelling catheter in the patient, and we used to irrigate the bladder. And after 24 hours, usually take the catheter off, and when the patient passes urine, we allow him to go home. And after that, the first week or the first week or two, the patient has to be having some rest, and after that he can slowly return to work.
Right. And also, Doctor, we mentioned at the beginning of the program that it is most common in men above 60 years old. But does it really restrict to men above 60 years old, or how does the age matter in this condition?
Yes, that's a very good question. Actually, sometimes the size of the prostate does not matter. Sometimes we have seen patients who are having small prostates having prostatic obstruction, and people who are having big prostates does not have any symptoms at all. So actually, when the prostate blocks the inner part of the urethra, so that's only it gives problems. Sometimes patients who are about 40 years can have symptoms, and who are 70 years may not have symptoms.
That's how it goes. Now, doctor, also, if a person really doesn't identify these symptoms in them, they might ignore this condition. So if this condition is left without being treated, what will happen, doctor?
Yeah, in some instances, without the patient's knowledge, if this is left untreated, suddenly he finds it difficult to pass urine and he is unable to void, and we call it acute retention of urine, and at that time he might need a urinary catheter. And in some instances, without knowledge, this prostate obstruction can be so severe, we call it high pressure chronic retention. In that case, all the kidneys may be already damaged by the time of the diagnosis.
So that is, I think, a very good advice. Before you get your kidneys damaged, be aware of the way you pass urine, and we spoke about the symptoms today. It is very important as a person for you to keep track of your daily lifestyle, right, doctor? Because urinating is a process of your daily lifestyle, and if you keep a proper note on it, you will avoid going into a major risk with kidneys to everything. So along with that, doctor, what is the right time for a person undergoing this condition to get medical advice?
Firstly, the person feels that the urine stream, that's the most common thing, is that the urine stream is weak, and the time for urination usually prolongs. So I think that's the time you should make note of it and get proper medical advice. Sometimes not your friends, your family members might notice this, right? And you find it difficult to go on a trip and to hold urine, and sometimes this can cause isolation, social isolation. So you try to avoid such going into such social gatherings, and so on and so forth. Actually, that's the right time to seek medical attention to avoid such unnecessary things in life.
And doctor, finally, we have come to the latter part of the program today. Let's talk about the facilities provided by Lanka hospitals in getting, from the moment a patient or a person with this condition comes into the hospital, how are the facilities here at the hospital?
Yeah, here in the hospital we have the dedicated urology center. So when you come there, you can meet a consultant and get all your the assessment, medical assessment done at single visit.
Right.
We call it a one-stop urology center, and we have the ultrasound scan on site, and we have the flexible cystoscopy, and we have the uroflowmetry, everything on site. So everything can be done on the same day.
So like he mentioned, Lanka Hospitals is a one-stop urology care center, and if you're a person undergoing this condition, it's just a matter of stepping into Lanka Hospitals, and it is the first hospital with one-stop urology care center in Sri Lanka. And if you are a person who's looking for more information regarding this, you can contact the urology department at Lanka Hospitals through the hotline 077-131-3915. Let me repeat, 077-131-3915. So thank you so much, Doctor, for joining with Art Mediline today in giving out awareness about this condition we spoke today. Thank you so much for joining.
You're welcome.
So that's all about today's Art Mediline. See you again on another day. Thank you so much for joining.
Curing.